I'm Kelly Cervantes, and this is Seizing Life, a weekly podcast produced by Citizens United for Research in Epilepsy, CURE. On today's episode, we speak with Wendy Katten and Laurel Henson about the nursing shortage at the Chicago Public Schools. This shortage has a dramatic effect on the quality of care for students with epilepsy. Wendy is the founder and board member of Raise Your Hand Action. This group is the leader in the fight for higher quality nursing care for Chicago Public School students. Laurel Henson is the mother of a 6-year-old child with epilepsy who attends a public school in Chicago. She is also an advocate with Raise Your Hand. Wendy, Laurel, thank you so much for joining us today. So what is the nursing shortage that you're currently seeing in the public school system?
Well, right now we've been hearing, I lead a grassroots parent organization, and we've been hearing from parents weekly who have no coverage in the school for a variety of nursing issues. We've been meeting with the district, and we found that they're just way under for the number of positions that they need.
So now, is this for the nurse that's in the school that is in like the nurse's office, that when the kid has a fever,
Right.
that's where
The days
they go?
of having a full-time nurse in the schools are like long gone. And so we have parents who have kids with daily medical needs, who require medical intervention, or who need the administration of emergency medications, who have no one there to cover for them. And so our district is just, they only have 104. We have about 500 schools, certified nurses, and they're filling in a lot of schools, but not all, with nurses from a temp agency. And that's causing a lot of problems because the sort of nature of temp agencies are that people are, it's a rotating crop of untrained people often who don't show up. So you have parents who are being called, if they're lucky to even have a nurse in the school.
And, I think it's important, first of all, just to go back, I think a lot of people are unaware that there isn't a full-time nurse in many of these schools.
Right.
So you're talking about the statistic that you gave, about 100 nurses for 500 schools. So that's 20% of the schools have nursing, meaning 80% do not. And in terms of, the temp nurses, so awesome that you can get someone in there if it's just a student that doesn't feel well that day or vomits. But when you're talking about chronic medical conditions where you really need that nurse to know, okay, this is, in terms of epilepsy, this is what this student's seizure looks like. This is, you hope as a parent that you can go in and talk to that medical professional and give them parameters. But if it's a different person every day, every week, then how are you can't have that conversation with a new person every single time to educate them on your child. How have you seen this impact you? Tell us about your son.
So my son is 6 years old, and he has periventricular leukomalacia. Which because of that, he has cerebral palsy, epilepsy, he's hemiplegic. And so his seizure started when he was 2. So from a school setting this year, because he's no longer getting naps, he's in first grade. He was we had put a nap into his school day last year. They've gotten increasingly stronger and stronger. And so the nurse that is assigned to my son's school actually rotates to 5 other schools. So one day she's at my son's school, one day she's at a different school and so on. But that's actually just that nurse. My son's school is actually an offshoot. It's called a primary center. So CPS is actually renting a Lutheran school from this church. And so kindergarten and first grade. So the nurse that's assigned to my son's school per se actually never goes at all to my son's school, because it's off campus. It's the primary center is my son's school, and then the regular school is it. So when she's rotating, she only goes to the main building. And so they don't have, nursing isn't for headaches. It's not for fevers. It's not for anything. The nursing that is there, like the ones that are agencies, have been assigned to that school because of an IEP. So it's not to actually help the other kids. It's because there's an actual nurse that's there, that's an agency nurse that has been required to be put on for the IEP. So what I've been requesting is them to addend my son's IEP, because there's been four letters from 4 different physicians, 3 epileptologists in his primary care, saying there has to be a nurse here. They have to be able to triage. And because they're making me jump through hoops, they still haven't, this is 2 years now. 2 years I've been requesting a nurse, and they haven't done it because I didn't use the term like to addend onto the IP. I didn't know you had to.
They're finding different
They're finding ways to get around it. So then
around
as
it.
soon as I asked, like, I want an emergency IP, I want this addended to his, then all this stuff started moving. I requested the emergency IEP in June. They said, sorry, it's at the end of the school year. You'll have to wait till the new school year. I requested 3 weeks prior to the new school year to have the emergency IEP. And then they actually, it got pushed and pushed and pushed to coordinate with everybody till November 11th. So from June to November, I finally had my meeting. I had to get an attorney involved. And I'm like, I'm not asking for a one-on-one. I'm asking for you to have a nurse on staff in case there's a problem, because he has an emergency rescue medication that has to be administered rectally. They have no one to administer it. And so their resolution was, well, we'll call 911. I'm like, well, that's, the closest ambulance center is 2.4 miles from this school. There's no way they can get here in 5 minutes. Well, then we'll send the nurse from the other school over.
Well, and not to mention that calling an ambulance into the school is not only expensive for you based on whatever your insurance provides, it's also disruptive to every other child in that school. Also the potential, awareness and embarrassment for your son to have that be that much attention and that much focus.
And he's 6.
Yeah.
You know what I mean? So he's starting to understand, he's still, because of his delay from like speaking, he's still a little immature on certain things, but he's starting to understand the dynamic of I'm different. And,
Now, is he integrated into a mainstream classroom?
yeah, he has no cognitive delay.
Okay.
So he reads at a 3rd grade level. He's actually quite brilliant, but
Wow.
he's got the seizures. And I think that's also part of the problem is because he is high functioning, they disregard a lot of my problems because they're like, well, he can speak. I'm like, did you read his IEP? He didn't actually speak until he was 3 years old. Like,
Right.
he looks like a normal kid. Unless you're really focusing, you can't tell that, when he gets tired, he starts to fist, his eye starts to droop, that kind of stuff. And so because his injuries don't look egregious enough, I think that's a lot of the problem. And that's why I'm having to fight as hard as I am, because it's like, well, no, you're looking at how hard I've fought to make sure that he got the therapies he's needed, because I've literally pushed and fought and pushed and fought. But I'm like, listen, guys, like my whole goal is that, by the time he's 8 or 9 years old, he doesn't have to do all this stuff, that he doesn't have to have all these therapies.
What is the district legally required to provide?
So by laws that were passed in the 70s, students have a right to a free and appropriate education, despite any disability. They are not required by law to provide a nurse. That's not mentioned in federal law, but they are required to provide the care that a student like Mason and all these other kids that we know of can get. So, that's up to the district. And there are a lot of issues at the state level around like the Nurse Practices Act and kind of infighting among adults, I would say, around who's going to take the lead. But what we're seeing is parents are left to sit at the school, or in your case, just have no one trained while you have to be at work to provide the care. So we have so many parents who, whether it's a daily intervention, they need insulin or an emergency medication or something more extreme like, a ventilator, where there's just no one trained. And we're saying CPS needs to change their design system, and other districts have done that so that they're not relying mainly on these temp agencies who don't have the training. So they are required to provide care. Again, it's not stated that it must be a nurse.
So even if it is not legally stated that they require that there have to be a nurse there does have to be someone skilled and trained to allow them to get the same education as the child next to them that doesn't require the insulin shot or the emergency med, or so be it. Does it seem like the district is aware that this is an issue? Have they discussed a plan? Is there something they want to do aside from just, temporary nursing services to remedy the situation?
So we've met, our group of parents have met with the district 4 times this year, and they, they acknowledged that this is a major issue, and they told us that they were going to come up with a plan by December. Yet their plan was really only to triple down on the temporary nursing services, which the meetings, we brought parents who had been double dosed on insulin, who it conveyed in 4 meetings that the absolute wrong path to take is to just increase the use of temp nurses, because the real issues here are continuity of care and competency of care.
Of course.
Students need someone who knows them, who doesn't come in every day and not know their care plan, not know their needs, and that's what, or have no one. I mean, I think our district, because there are actually so many kids who require daily intervention, and they haven't figured that part out yet, and they're scrambling and redeploying the full-time nurses that they have to cover schools. They're in whack-a-mole sort of crisis mode, and they're looking at students like Mason and the many others that do have call 911 in their care plan, which is incredibly unsafe. It's the bottom of the priority list. I mean, in our meetings with them, they've sort of said they know they need to address the complex medical issues, the very fragile cases. They know they need to do better with the daily medical needs. Those are cases where students may absolutely have to have a medical intervention like insulin. And then they've got the emergency medicines. And my son had one too called glucagon when he was a student at CPS. It just wasn't even on their radar.
I actually went, sorry.
No, go ahead.
But I went and spoke in front of the school board because I was like, you guys have to do something. I'm a single mom. I have absolutely no help here. And, I own my own company, but I'm having to leave. I'm having to do all this stuff. So it's affecting my entire life.
I can't even imagine you get the call from school and
I have to go.
And you have to go. You have to drop everything. That
drop
means
everything
that you
and I go.
cannot
I've been
be far from the school during the day.
I've been in meetings where I'm at, rush with one of my clients, and I'm like, I gotta go. Like, I've got to leave, And so we went back and forth about this in November. One of the people from CPS is like, well, he wasn't having seizures during the day last year. And I'm like, well, that's impossible because we did this EEG for 23 hours, which was during the day, and he was having seizures on this EEG. So that means that you're actually proving my point that the people in this facility are not trained, they're not capable, they don't know what they're looking for. So then I sat down with CPS and said, you guys need to understand what the kind of seizures are, because Mason has a type that's extremely rare, because that's the one that causes brain damage. And, still, I have no idea if they've had the training, but I get multiple calls like, hey, Mason's having seizures, he's acting weird, this is what's going on, he's saying this. Because we just did a new EEG in December, and it's showing that his seizures are even stronger now than they were back then. And because they keep getting stronger and stronger, he went from like maybe 1 or 2 a day to 8 or 9 a day. And they're just getting more and more. And so it's like, I have this system in place to have this emergency medication administered, but it has to be a certified person to do it because it has to be done rectally. And there's nobody. And so I'm saying like, hey, his seizures are getting stronger. You guys need to do something. This needs to happen. And the other side of it is, for the teacher. And I honestly kind of feel bad for the teacher too, because it's like, she's trying to educate these kids, and my son's like yelling, alert, 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 because whenever he has the seizures, I've told him, like, you need to alert her. You need to know, because I have to start keeping track of these. So this is another phone call today. Like, I had to rush to school to give him his rescue medication. And then after I gave him one of his rescue medications, I'm like, okay, he should be good. Like, these are myoclonics. They shouldn't be causing any brain damage. If there's anything weird, call me. Like, if he has anything, his face turns purple, you call me immediately. Call 911 immediately. Don't even mess around at this point. Don't wait the 5 minutes. Call. Right. And they call me back. They're like, he's saying alert, alert a bunch of times. I'm like, oh yeah, that's our new system. So he's going to be doing this. And it's disruptive to the class as well, because my son is yelling alert every time he's having a seizure. But I don't care at this point, because I need to be able to keep track of it. But, it's also, it's not fair to the other kids that are, in a sense, like normally functioning.
But it wouldn't be an issue if they had
A
a
nurse on
proper
staff,
nurse
yes,
on
because
staff
she would be able
in
to
the
triage
school.
it. She would be able to sit with him. She would be able to administer that rescue medication.
And it shouldn't be the responsibility of the teacher to try
Be
and
able
have
to figure out, like, is he having one? They moved him closer up to her, you know, and it's just, it's a lot. And it's a lot for him too. When he comes home, he's exhausted.
Yeah.
He goes to bed at 6 o'clock at night. He's not like a normal kid that's going to bed at his age at 8 o'clock at night. He's done at 6 o'clock. So I'm like, you know, it's tough.
Yeah. So parents who are in a similar situation, who are facing these nursing shortages in the school, who are having to run back to the school to administer meds, what services, what advocacy organizations, what resources are available to these parents?
Well, first of all, they should absolutely file a complaint with the Office of Civil Rights. And the problem is many parents don't know that that's an option. Some of the parents that I know who have filed a federal complaint have had their situation resolved. That's a first step. Another thing is there are a number of disability rights organizations, advocacy groups, parent groups working together right now. And, you know, we can always refer parents to some of these groups like Equip for Equality, Access Living, Legal Health Justice. My group is a parent group. It's called Raise Your Hand for Illinois Public Education, and we're constantly referring parents to these organizations where they can get further help for their situation. For some reason, sometimes they are not yet getting resolved, and I mean, it's outrageous, the stress this is putting on parents and children who deserve an advocate as an adult in the school and shouldn't have the stress of being alone and lost in a school where there's no one for them. I mean, it's against the law, and it's also immoral to do this to our kids. So I would start with the Office of Civil Rights complaint. If you have a child that needs services, in medical services, and no one's providing the care, and you've tried to work it out with your school, there's a simple complaint form, and then they can contact us at info@ilraiseyourhand.org, and we can always put people in touch with some of the advocacy groups, because there are you know, there are free resources to help parents, you know, and this is also an equity issue. In Chicago, it's a district that's, you know, 85% low income. I think sometimes districts are banking on the fact that low income people are not going to fight, and no one should have to be in that place, right?
You know, I imagine that's, you know, in an urban school district, this is probably something that's seen across the country.
Yes.
Frustrating.
To that end, is there a gold standard out there? Do you know of cities or districts who are doing this
You know,
well?
there are districts that do this much better than CPS, and in our meetings, we've given CPS job descriptions in sort of design systems. Like I know in Nevada, where my sister-in-law is the principal, it's a low-funded district like CPS, but they've managed to hire a health clerk for every school, and those are lower-paid jobs, but they can do a number of medical tasks to offset sort of what those 100 full-time nurses are doing, and allow them to do the medical intervention. And again, these are lower-paid, non-nursing positions where they can cover a range of tasks. There are other creative solutions, and we've put some of them in the hands of the highest levels of CPS. But there's the problem, I believe, is there's not a real urgency and sense of responsibility to make all kids a priority and to get this done. And so that's what we're continuing to push for.
Yeah. Well, ladies, thank you so much for coming on, for your passion, for sharing your stories. I think that it's just so important to shed light on these issues, that, these problems do exist, and it is not just the issues of the students with the additional medical needs, but this does have ramifications on the entire school, on the entire classroom. And just because someone's child may not have a medical condition today that requires this assistance, they could tomorrow. And we need to stand strong as a community. So I just thank you both so much. Thank you for fighting for all of our kids. We appreciate it. And thank you for taking time to be with us today.
Thanks for doing this.
Thanks for having us.
Thank you so much, Wendy and Laurel, for discussing this critical issue affecting students in the public school system. I have to admit that learning about nursing deficiencies in public school systems does not necessarily surprise me, but that does not make it any less unacceptable. Students have a right to adequate resources and proper care so that they can attend school and learn in an environment that is safe for them. To help shine a light on this issue, we want to ask you to share this episode on Facebook, Twitter, and Instagram. Thank you so much.